Okay. I want to kind of slowly go over this roadmap. I hope that you can reference it during your time in the hospital. A lot of you will be either diagnosed in the outpatient setting, perhaps off of an abnormal complete blood count or CBC that your primary care doctor or another doctor obtains and notices some abnormalities. Some of you may present to the hospital with complications like those symptoms and presentations of patients with leukemia, leading to complications and needing a hospitalization initially for that. But no matter how you are diagnosed with acute leukemia, your first hospitalization that will go over the diagnostics, treatment, and then eventual count recovery will likely take place for about 4 to 6 weeks. I want to just set some expectations because this can be a long journey overall, and especially a long journey in the very beginning where things are getting going and you're realizing that your hospitalization may be a few weeks long. So we'll divide the hospitalization stay into about 3 kind of buckets. This first bucket is diagnostics. We'll talk about the various testing that's done to set you up for optimal treatment, which is that middle bucket. This will be your first cycle of chemotherapy or that induction chemotherapy. And then the third part is really watching your body and your blood counts recover after we've given you intense chemotherapy. And then we get you closer to discharge out of the hospital. Okay, so our first section we'll go over is the diagnostics. You will probably be getting more testing than you have ever had before. There will be lots of blood tests, and we do them for certain reasons. We aren't doing this willy-nilly, but it's really to help characterize the type of leukemia that you have by running certain tests on your blood cells that are in your blood. We also want to make sure that we're ruling out any infections. Some infections you may have presented with symptoms. Other infections may be more dormant that we need to address before treatment. So there will be blood tests for that. And then we'll also be monitoring your blood counts daily to watch those 3 blood cell lines, your red blood cells, your white blood cells, and your platelets. You may need blood transfusions depending on if those blood counts are low. But all these tests in the blood are all to help optimize you for your type of treatment. Now, a big part of diagnostics for acute leukemia is the bone marrow biopsy. We'll go over this procedure a little bit more in detail in the upcoming slide, but this is a small sample from your hip bone to confirm the type of leukemia. Your hip or pelvic bone is actually a major site of your bone marrow, that factory of producing blood cells. So getting a small sample from there can be very helpful for your doctors to figure out what type of leukemia you have and how best to address it. And then there may be other myriad amount of imaging and additional testing. You may have CT scans or CAT scans to look at your chest, abdomen, pelvis, and make sure there aren't any hidden infections that we need to address. For some patients, they may require a lumbar puncture, which is when we take a sample of your spinal fluid done under sterile technique. Not for every patient with acute leukemia, but your care team will help guide you on that. They also might include an ultrasound of the heart or an echocardiogram to check that heart's function, especially dependent on what type of chemotherapy you may be given.